My name is Mark Emberton. I'm a Professor of Interventional Oncology in the Department of Surgery here at UCL and also Dean of the Faculty of Medical Sciences. The student that's lucky enough to choose this project will take part in one of the biggest revolutions in one of the most common cancers, and that revolution is one of location. We've been treating prostate cancer now for 100 years, blind to knowledge of where the tumour is. MRI over the last few years, through studies largely led through UCL, has given us location and told us where the tumour is, which means we can attribute volume, means we can also direct a needle to it in order to make the diagnosis with precision. However, MRI is oversubscribed, MRI is expensive, MRI is not widely available. And so this project looks at other ways of deriving and eliciting location without recourse to lying in a scanner for 40 minutes. And we're going to exploit certain attributes of the tumour and interrogate the difference between tumour and background tissue to tell us what's cancer and what's not. And hopefully this technology will be sufficiently robust and sufficiently inexpensive to be used throughout the world, which is something that MRI is not amenable to. So we're now going to hear a little bit more about the physics involved in this challenge.
Hi, I'm Nader Safari. I'm a professor of ultrasonics and I lead the ultrasonics group at the Department of Mechanical Engineering, UCL. With this project, we are planning to develop a novel method for the detection of prostate cancer. We propose the use of shear waves transmitted and detected from the urethra for the detection of prostate cancer. Shear wave elastography methods are providing great promise in the future of diagnosis of cancer in the clinic. Now with cancer nodules, their stiffness tends to be a lot higher than normal healthy tissue. With prostatic cancers, there is a change of 1.5 times to 4 times in their shear stiffness compared to normal tissue, which provides us with a method for providing a contrast in our images. With conventional ultrasound, transrectal ultrasound or TRUS, you do not have good enough contrast to be able to detect the cancer normally. And that's because, whereas in the case of the shear stiffness, which is what we are going to be looking at, the changes are of the order of 4 times, the bulk modulus of elasticity, which conventional ultrasound depends on, only changes by, say, 1%. So the aim of this project is going to be to develop fast and accurate image reconstruction methods based on 2 approaches. The first one is reverse time migration, which comes from geophysics, as it happens. And the second is a method which is based on genetic algorithm techniques. Both of these methods rely on the physics of interaction between shear waves and inhomogeneities in the prostate. So we need to have good forward models for these reconstruction methods. We also need an analytical method, an analytical model that describes the contact mechanics between the probe and the prostatic tissue. This is because we want to optimize the transfer of mechanical energy between the probe, which is in contact with the wall of the urethra, into the bulk of the gland. Encouraged by initial success in applying these reconstruction methods to 2-dimensional geometries, we now want to take things one step further to make things a little bit more realistic and have a look at a 3-dimensional scenario, of course, and also to include the inhomogeneous nature of natural prostate into the reconstruction algorithms.
Why UCL? Well, I think there are 2 main reasons. The first is that we're a major multidisciplinary university, and that means that clinicians like myself can work with world-class scientists to address unmet need. The second is our proximity to some of the best characterized patient cohorts in the world, and that's as a result of our extraordinary partnership with some of the best hospitals in the world. At UCLH, for instance, we treat all the men with prostate cancer from the whole of North London and therefore have one of the largest prostate cancer services worldwide.